Modern medicine excels at the acute crisis. We can clear a blocked artery, excise a tumor, or neutralize an infection with extraordinary precision. Yet chronic, systemic conditions continue to rise, and our current interventions often fail to restore long-term flourishing. The standard approach treats health as a set of discrete data points. Symptoms are logged, biomarkers are tested, and diagnoses lead to targeted pharmacology meant to suppress specific pathologies. Measured, analytical, this sequence relies on a category error. It views the human body as a closed biological machine, treating the patient's environment, their food, their work, their stress levels, as mere background noise. But the body is an open system. When a biological mechanism faces external force vectors it wasn't designed to process, the internal gears begin to grind, stutter, and eventually fail. Attempting to repair a machine in isolation is ineffective if the surrounding environment continuously forces the system to break. Solving for chronic disease requires a broader definition of health. We call it life capacity, the embodied physical power of an organism to adapt, repair, and participate in its world. This capacity depends on organism-niche coupling. The body and its environment exist in a continuous, inseparable feedback loop, where the organism effectively metabolizes the conditions of its niche. This relationship is mapped across 6 distinct levels, tracking life conditions from global systems down to biological processes. Large-scale conditions at level 6 translate into physical changes at level 1, fundamentally altering cellular regulation and the body's ability to heal. Addressing chronic illness requires a functional bridge between this inner biology of cellular repair and the outer field of environmental affordances. We begin with salugenesis. This is the internal, biologically ordered sequence an organism must complete to successfully repair its tissues after an injury or threat. The process starts with the cell danger response. When a cell detects a chemical, physical, or biological threat that exceeds its limits, its mitochondria switch their primary function. They stop focusing on energy production to prioritize cellular defense. The mitochondria halt metabolic flow to build a defensive perimeter. At this stage, the cell redirects all its resources towards survival. This shift initiates inflammation, the necessary, highly coordinated first phase of the healing cycle. Once the threat is contained, the cell moves into proliferation to replace damaged tissue. Finally, it reaches differentiation, returning to its specialized role to restore normal function. We can define chronic disease as a healing cycle that has become permanently trapped in this initial inflammation and defense phase. The tissue remains caught in an unresolved defensive loop. It constantly sounds the alarm, never receiving the resources required to move toward repair. Biological healing stalls when cellular mitochondria are continuously commanded to prioritize defense over differentiation. To understand why a cell remains stuck in defense, we must look at salugenesis. This is the external field of resources and meanings that make internal repair possible. Biological cellular repair is an energy-intensive process. The organism needs specific environmental affordances, external conditions that provide the safety and fuel required to exit a defensive state. These requirements are detailed in the Level 5 affordance field, representing the foundational elements of a health-generating environment. A cell needs metabolic recovery from deep sleep, stable nutrition, and relational belonging. Without these, the signal to stop defending never arrives. A clinical intervention alone cannot resolve a chronic condition if the patient's niche continues to demand a persistent stress response. The path from the environment to the cell is governed by the exposure-repair balance. This functions as a biological accounting system, where different forces are weighed against the body's capacity to recover. On one side is the exposure field, including physical demands, chemical toxins, nutritional deficiencies, and psychosocial stress. On the other side are restorative margins. These are the reserves of time, physiological safety, and community support that allow an organism to absorb a disturbance without a systemic breakdown. When cumulative exposures breach these margins, the organism loses the metabolic flexibility it needs to complete its healing cycle. As the structural load exceeds the restorative capacity, the system reaches a breaking point. The cells below lock into a state of chronic inflammation. Chronic pathology emerges predictably when the continuous demands of the niche outstrip the organism's restorative margins. This model allows us to trace a path of pathology from broad societal systems directly into the individual's biology. A disruption at level 6, like the privatization of a civil common or the degradation of an ecosystem, cascades downward. It manifests eventually as a disruption of cellular proteostasis at level 1. These harms often persist because of capture modes. Factors like measurement violence or commercial capture create blind spots, causing institutions to focus on narrow metrics while the underlying causes of systemic injury go unaddressed. The environment is not a separate entity. It is the medium through which we live. The body metabolizes the air of a polluted skyline or the stress of an insecure workplace as immediate biological data. Treating a symptom at the cellular level without addressing the environmental disruption at the macro level ensures that the pathology will recur. This framework shifts our focus from simply managing symptoms to actively transforming the systems that produce them. Realignment begins with de-implementation. This means removing the harmful practices and administrative burdens that actively block our capacity for repair. Creating health is structural design. It involves restoring civil commons and redesigning our daily affordances to protect the restorative margins of every individual. Every policy, technology, and clinical rule should be evaluated by a single question. Does this system expand the embodied capacity of a human being to repair and flourish? The future of medicine depends on engineering an environment that inherently affords life. Our goal is to move beyond the mere management of biological decay and toward the creation of conditions where healing